Hi, Dr. John Torres here with NBC News on this Facebook Live. And if you were with me about 10 minutes ago, I was having some audio problems. Can't quite figure that out. So now hopefully this works a lot better here. But essentially what I want to do is catch up on a couple of headlines behind coronavirus and also at the same time answer some questions you may have. So if you have questions, please send them our way. I'm going to go ahead and answer as many of those as I can. But first, let me start off with a couple of headlines. First and foremost, you might have heard over the weekend, the World Health Organization, the WHO, came out with a statement saying, be careful with antibody tests because, number one, we don't know how accurate those tests are. And number two, we're not even sure that having antibodies to coronavirus actually stops you from getting it a second time. Some of the headlines actually said the World Health Organization is saying you can get coronavirus a second time if you already had it. That's not what they're saying. What they're saying is we don't have enough information at this point. And there's actually a very sound scientific reason behind that. Right now, the coronavirus, if you think about it, it's been around for about 4 or 5 months. Usually it takes years to find out how much protection we have from the antibodies that build up in our body. And what happens is when you get coronavirus, when you get this virus, it all of a sudden develops these antibodies in your immune system. That's what fights off the actual virus. When the virus goes away, those antibodies stick around. So if it starts coming back again, the virus, the antibodies are ready and they're prepared to fight it off again. So you typically don't get it a second time. Now we know that when you get coronavirus, you get antibodies afterwards. What we also know is that some people get high levels of antibodies, which we think will give them good protection, and some people get very low levels of antibodies, which we're not sure if that'll give you protection or not. Plus, we're not sure at what level you need those antibodies. So that's what the World Health Organization is saying. We don't even know that if you do have antibodies, if that's going to protect you from coronavirus getting it a second time, although we think it will. We don't know how long that protection will last, although we think it'll last at least a year, if not longer. On top of that, they're also saying that the coronavirus tests out there have come out so quickly, and there's so many of them, the antibody tests, that we're not sure of the accuracy of those. And so the concern is that people are going to get those tests. They're going to get what's called a false positive. In other words, they're going to take the test thinking, okay, I had coronavirus at some point. I have antibodies to it now, so I don't really need to take many precautions. I can go out there and do what I need to do and get close to people and not worry about it. The concern there is if that's true and it's a false positive, they could be spreading coronavirus to other people if they have it, so they have to be very careful. So they don't want people to let their guard down. They don't want people to stop social distancing. They don't want people to stop wearing masks just based on those tests as of yet. But those tests do have some utility, and that's the reason you're seeing so many of them out there. A couple of things. One, they can give people an idea if maybe they do have a little bit of protection, but at the same time, they still need to go ahead and maintain those precautions. On top of that, from a population point of view, they can tell researchers and they can tell public health experts how much coronavirus has been in an area. Because up until now, testing has been really difficult, especially the test that tells people if they're actively sick. That's different than the antibody test. The ones that tell them if they're actively sick, they've been few and far between. They've been hard to get. And since they've been hard to get, we don't really have a good idea of how many people in a certain area have it. And we don't have an idea if that's fluctuating up or down. So getting those antibody tests can help. It's one more tool in the tool bag that public health experts can use to find out what this virus is doing to communities. So again, the message here is not that you can get coronavirus a second time or that these tests are rubbish. The message here is that these tests need to be used appropriately, but you can't get a false sense of security if you do have a positive test. You still need to take the precautions, especially if coronavirus is hot and heavy in your area, in your community. Now, the second thing you might have heard of is the CDC actually came out with 6 new symptoms they're attributing to coronavirus. Up until now, they've used basically 3 symptoms. It's been cough, shortness of breath, and fevers. And those are the ones they say are the main symptoms behind coronavirus. But they've added 6 new. They said chills, repeated shaking with chills, muscle pain, headaches, sore throat, and then the new loss of sense of smell or taste. Now, we've talked about these in the past and how these things might actually contribute to coronavirus, but up until now, they haven't been symptoms that they pointed out saying, if you have those, you need to start thinking about coronavirus. The reason this is important is for a couple of things. One, it tells people, okay, I had this weird loss of smell, loss of taste. I'm not really sure what that was, but maybe it's coronavirus. Maybe I should get tested. Number 2, all I had really were muscle pains. I just had a lot of pain at one time. Is this something I need to worry about? So that's going to tell people that even though you don't have all these symptoms, if you only have one, sustained headache for one example, that might be coronavirus. You need to think about it and protect yourself. Isolate yourself from other people to protect them as well. On top of that, it's going to open up more numbers of people who should get tested. In a lot of areas, testing is reserved for people who have coronavirus symptoms. Up until now, it's been those 3 symptoms, but now we have 6 symptoms on top of that. So 9 full symptoms. Plus, the CDC is also saying there's some precautionary ones. If you have these following symptoms, you need to seek medical attention immediately. That means 911 ambulance type situation. Trouble breathing, persistent pain or pressure in the chest, because it could be something other than coronavirus. It could be heart issues. It could be other things as well. New confusion or inability to arouse. That usually means that somebody is very sick or having very much problem breathing. They can't get enough oxygen to their brain. Bluish lips or face, the same thing there. So a lot of these are respiratory. Some of them are not. But it's basically saying these are the emergency signs to go and call 911. I'll go over them again. Trouble breathing, persistent pain or pressure in the chest, new confusion or inability to arouse, and bluish lips or face. Again, those are the emergency signs. The other 9 were signs to think about, okay, I probably have coronavirus. I need to isolate myself from other people and see if I can get tested. So again, a couple of things here. One is the World Health Organization, the WHO, saying those antibody tests do have a utility, but you have to be careful. You can't let your guard down, even if you had a test that turned out to be pretty good. And number 2, or turned out to show that you have antibodies to it. And number 2, there's those new 6 signs of coronavirus, 6 symptoms of coronavirus that you want to be on the lookout for. And if you do have those, start thinking, okay, I need to protect other people from me. I need to take care of myself, seek medical attention if things get worse, and look at a test. So now let me see if we have any questions here that I answer real quick.
Are antibodies shown for coronavirus or specifically COVID-19?
So the question is, are the antibodies for coronavirus or specifically COVID-19? And that's actually a very good question. The antibodies themselves are for the virus. The virus is called SARS-CoV-2. SARS is severe acute respiratory syndrome. CoV is coronavirus. And 2, the reason 2 is because the original SARS coronavirus was back in 2002 and 2003. That's the virus. And that's what antibodies fight against. And that's the antibodies are testing with the antibody test. COVID-19 is the disease, and that's the test, nasal swab test or the saliva test people are using now. So the nasal swabs, the saliva test can tell you if you have COVID-19, the disease. The antibody test can tell you if you had SARS-CoV-2 virus in your body at one point and your body has developed the immune system antibodies to fight off. So again, a great question. The big distinction there is one's the virus, that's the SARS-CoV-2, one's the disease, that's COVID-19. The virus causes the disease. But fantastic question. Let me see if we have others as well.
There's a confusion on masks. Why aren't people wearing them if we've been talking about?
So the big confusion about masks and why aren't people wearing them. A lot of people I've heard from different areas. I'm here in New York City, and it looks like 30% of people, just on kind of random surveys, aren't wearing masks. So the CDC has come out with a recommendation that people should wear masks when they're outside, specifically if they're going to areas where they can't do that social distance, that 6 foot of distance. And that means grocery stores, pharmacies, public transportation, areas like that where you can't get that 6 feet of distance. On top of that, they said you want to make sure you wear masks if you're in an area that has a high level of coronavirus cases, a sustained level of coronavirus cases. But a lot of experts are saying, if you go out and about, just simply wear a mask. There's a couple reasons behind wearing it. Number one, you wear them because it does offer you a little bit of protection. Not a fantastic amount of protection, but a little bit of protection. Because, again, it's those respiratory droplets, somebody coughing or sneezing, and that getting towards you into your mouth or your nose, or even your eyes. The issue is, the main thing the mask does is it protects other people from you. And even though you feel fantastic, even though you feel great and have absolutely none of those 9 symptoms we were talking about, it's still possible to have coronavirus and to be, when you sneeze and cough, sending those viruses out to other people. We do know that before you develop symptoms that you can start getting the virus by coughing and sneezing and those viral particles getting out. But we also know that up to 50% of people never develop symptoms of the coronavirus. And so we're trying to make sure that, especially in communities where there's sustained high levels, that everybody covers up. So that way those people that might have coronavirus but aren't showing signs, they don't know they have it, they're showing to be sick, don't spread it to other people. Extremely important that we all protect ourselves. The other thing is when you wear a mask, make sure if you bring it inside, when you bring it inside at the end of the day or end of whatever you're doing, just to go ahead and simply wash it off. Soap and water, in the washing machine, in the dryer. That's a great way to wash it off. It'll kill the virus, and you can wear it again the next time without any issues. You usually want 2 layers. That's what these recommend, 2 layers back to back. You can have the ear loops or the one that ties up. They both work fantastic. Just make sure you wear them appropriately. I've seen people wear them down here below their nose. That's not helping anything. I've seen people wear them here, not helping anything. And again, the one thing you want to make sure is when you're wearing it, that you're not constantly touching your face trying to adjust the mask, because that can cause the issue again of transmitting it through your hands into your mouth, your nose, and your eyes. Big things you want to avoid. So another question?
Is the virus mutating? It seems like younger people are getting strokes and having issues.
So the question is the virus mutating? Because we're hearing about younger people having strokes and having other issues. Now, you're hearing news about younger people. We're talking people in their 20s and 30s that have had strokes or stroke-like symptoms because of blood clotting from the virus. We're also hearing anecdotal cases, 1 and 2 cases here and there, of children that are having issues and getting very sick and unfortunately dying because of coronavirus as well. Whereas early on we said children seem to be a little bit protected. Children do seem to be a little bit protected from this, but you are going to get the handful of cases that this does have to. With the 20, 30-year-olds, we do know that coronavirus actually can cause this clotting issue, and that can be happening to them as well, causing the stroke-like symptoms or stroke issues. The main thing is it's not the virus mutating, it's the fact that we're finding out, because the numbers are so much bigger now, that we're finding out that more and more of the little things are happening. Not little issues for the person, but numbers of things are happening to people across the country. So the more you have, the more these rare cases are going to start popping up, and that's what's happening here. So it doesn't look like the virus is mutating to a great extent. Viruses always change, but it doesn't look like it's changing to a great extent to where it's another virus that we have to worry about. Instead, it looks like what's happening here is the numbers are creeping up so high that we end up having these little cases here that normally are rare are popping up every now and then. So again, it's one of those things to remember. It doesn't mean mutation. It just means that we're seeing more numbers, and because we're seeing more numbers, those rare cases are popping up to the top. We're able to see more and more of those, and that'll continue to happen. So again, a couple of things here. The World Health Organization said, be careful with the antibody tests. They're a good tool to have. They're just one tool that we need to use to keep this under control. So don't get a false security saying, I had an antibody test, therefore I can go and do whatever I want. No, you still need to protect yourself from other people and protect other people from you, just in case it's a false positive. Those tests will get better over time. We get more numbers of testing, and we get a idea of what we actually need. Number 2, the CDC has come out with new symptoms, including chills, what we call chills, headaches, loss of sense of smell or taste, as things that could be coronavirus if in and by themselves, not necessarily accompanying the other ones. So if you get those symptoms, be careful, isolate yourself, and if you can, go ahead and get tested. But overall, number one thing is things seem to be getting better across the country. Seems to be plateaued, if not started to come down, but we can't let our guard down. Now we're starting to open things up more and more. That means we need to be even more careful when we're out there. Social distance, a lot of hand washing, and keep an eye on news, keep an eye on public health experts to see if they're starting to say things are cropping up again, because we know once we start getting outside, those cases are going to go up again. We need to be very careful of that, because we might need to institute some types of recommendations like stay at those types of things if it starts getting higher and higher. But for now, enjoy it if you can go outside, but be very, very careful. Otherwise, make sure that you do the things you need to do to keep yourself and keep your family as healthy and safe as possible. Enjoy the rest of your week. Thank you.